Thank you for joining us for this OncLive Peer Exchange discussion, which features global perspectives regarding the management of advanced gastric or gastroesophageal cancer. Chemotherapy still plays a significant role in the treatment of advanced gastroesophageal cancers. However, progress with targeted therapies has extended survival and is expanding options for patients. Throughout this discussion, our panel of international experts in gastroesophageal cancers will explore the practical application of the most recent data. I am Dr. Johanna Bendel, Chief Development Officer at Sarah Cannon Research Institute in Nashville, Tennessee. Participating today on our panel are Dr. David Ilsen, attending physician and professor of medicine at Memorial Sloan Kettering Cancer Center in New York, New York. Dr. Manish Shah, Associate Professor of Medicine and Chief of Solid Tumor Service at Weill Cornell Medicine in New York, New York. And Dr. Kohei Shitara, Chief of the Department of Gastrointestinal Oncology at the National Cancer Center Hospital East in Kashiwa, Japan. Thank you so much for everybody for joining us today. I'm looking forward to a great discussion. Maybe what we can do is set a place for the discussion to begin in talking a little bit about the global trends in gastric cancers. So, Manish, how are we looking at the incidence, type, prognosis of gastroesophageal cancers, and how does that differ around the world?
Sure. So gastric cancers remains a significant worldwide global problem. Nearly 1 million people a year are diagnosed worldwide. There is significant heterogeneity across the globe. So in the United States, about 40,000 patients a year are diagnosed. It's much more prevalent in Eastern Europe and in Asia, South America. There is an association with some factors like H. pylori. Diffuse gastric cancer, which I know we'll talk about a little bit later, is actually uniform across the globe. One thing that's interesting is that we have made progress in treatment survival. So patients, at least in the United States, used to live about, 5-year survival was about 15%, now it's up to 30%. So that's, with a lot of the advances that we'll talk about today, but, the disease is declining in the United States overall.
Well, you mentioned H. pylori. A lot of questions that I get sometimes from referring oncologists is if you see a patient who's diagnosed with gastric cancer and the gastroenterologist found they had H. pylori, do you treat it?
Yeah, I think it does make sense to treat it. I mean, an active infection of H. pylori can lead to increased inflammation and that sort of thing. It doesn't actually have any impact on how well we can treat the cancer itself, but there's no need to have an active gastritis on top of the cancer.
I think another important point is to screen family members because the infection can track in other family members, and household contacts need to be tested and treated as well. And we know that treating Helicobacter infection does reduce the future risk of developing gastric cancer from Japanese data.
Yeah. What about in Japan? Is it as prevalent in Japan?
Yeah, in gastric cancer is still leading cause of cancer death, second cause of cancer death in Japan, and still 15,000 patients death from gastric cancer in Japan. Yeah. And yes, early screening is a standard procedure in Japan, so maybe we can pick up the patient earlier than other countries, but still 30% of patients were diagnosed as stage 3 or stage 4, very advanced disease. So to treat gastric cancer is very important. The infection of Helicobacter pylori is very common in Japan, approximately 80% in elderly patients and 40% in younger patients. Eradication is a controversial area because several randomized studies tried to assess the impact of eradication after ESD treatment for gastric cancer, but there is some controversial area. So even in Japan, we do not usually do eradication for all patients, but do eradication for patients who had a previous gastric disease such as ulcerative lesion.
Could I add to that? So I would agree with that. And just one thing to point out is that H. pylori is an endemic pathogen. So half the world's population has H. pylori, but only 1% of the world's population, if that 0.1, actually gets gastric cancer. So a significant portion of patients who have H. pylori won't get gastric cancer. So
Don't worry about that.
Don't worry so much.